Hi everybody, here's my little weekly video from Lara Land in Panama City, Panama. Sadly, still no surfing has been going on, and it will be some time before we get to that. Caesar and I are doing fine, and the new apartment is a huge improvement to life. The biggest thing we really like about it is there's a balcony and we can open doors, turn off the air conditioning and just live in the fresh air, and we really love the climate. So that's made a huge improvement. Now, instead of babbling on about myself this week, I wanted to talk to you guys about a couple of things about coronavirus. First thing is, should we take this seriously? And after that, I'm going to talk about antibody testing. But in the question regarding should we take it seriously, I'm surprised to note a lot of people online still making comments like governments are overreacting, it's really not much worse than the flu, and it's all just a giant overreaction, or even worse, it's a hoax. Sadly, it's not. I think we should take it seriously, and this is why. I think the most easily comparable global pandemic would be the Spanish flu, and the death rate there was about 2.5%. There's various different estimates for that. The death rate for COVID-19 might be anywhere from 1 to 5%. I see there's a lot of different estimates, and the reality is we just don't know, and we're not going to know maybe for more than 2 years what the death rate was. Let's look at the biggest, richest country in the world. Well, the biggest, richest, the United States. 328,800,000. If the death rate's the low end of the estimated range at 1%, that's still 3.28 million people in the United States could die of this. Global pandemics tend to run about 18 months to 2 years, so that could be a lot of deaths in a relatively short amount of time. Let's look at overwhelming the healthcare system, and let's look at ventilators, because this is a respiratory disease, and again the United States, because they've got great data and really good sources. From Johns Hopkins School of Public Health, I got the number of 62,000 ventilators in hospitals in the United States at the beginning or prior to the start of this pandemic, but 28,883 of those were for pediatric or neonatal, not useful for adults. And this is a disease that is affecting older people, not babies. So that leaves 33,117 full-featured ventilators that were available in hospitals. But hang on, they've got some stockpiled. Yep, they've got 98,000 basic function ventilators stockpiled. So that takes the total number of ventilators available at the beginning or prior to this pandemic. They've made more, not that many, but they've made more, 131,117 available within the United States. Now, from the CDC, I got the statistic of about 4.6% of people would be expected to be hospitalised with this disease in the United States. That could be 15,124,800 people may be expected, given that statistic from the CDC, to be hospitalised. Now, if we expect that they're possibly going to all be hospitalised over 12 months, and we take that number and we divide it evenly, because it won't all be at one time, yeah? It'll be over a period of time. If we expect it's over 12 months, that would be 1.26 million, 1,260,400 may be hospitalised in any given month. Or if we are more generous and we say maybe it spreads out over 18 months, that'll be 840,267 people could be hospitalised in any given month. Now, if we look at those numbers, not all of the patients who go to hospital with it end up on a ventilator. And I've found a low-ball figure of, say, 20% of people hospitalised will end up on a ventilator. If it's spread over 12 months, we could see 252,080 people requiring a ventilator in any 1 month. Or if you're more generous and spend it over 18 months, spread it over 18 months, that's 168,053 ventilators may be required in any 1 month. But remember, in the United States, there were only possibly 131,117 ventilators in the whole country available. And then the other problem is getting the ventilators that you have within the whole country to the right place at the right time. So there's a lot of logistical moving things around that would need to be done as well, which would require one organised, centralised, authoritative source organising and conducting this logistics. Let's talk about antibodies, because I notice that this is a thing that's coming up on the media, and some governments are now floating the idea of some kind of documentation to prove that you've had a positive antibody test, assuming that means some kind of immunity. We don't actually know if having antibodies to coronavirus means you're immune. You could actually possibly get it again. We just don't know yet. And you can't really take someone who has a positive antibody test and deliberately infect them with coronavirus to find out. So it's going to be a while before we get that data. The problem with some kind of documentation to show that you've had a positive antibody test is it could create a two-tier society. Those who have immunity and those who don't have immunity. When you think about it, if you don't have immunity, if you have an antibody test that shows you don't have antibodies, you could then find yourself discriminated against in housing, probably in insurance, possibly also in employment. There is actually a historic precedent of an epidemic where there was a two-tier society, and I found a really interesting article from Kathryn Olivarius of Stanford University. She's an assistant professor of history at Stanford, and her specialty is looking at yellow fever in the late 1800s in antebellum New Orleans, and there was a two-tier society. People found themselves, if they had immunity, they could access insurance, they could access employment, and they could access housing. People who didn't have immunity could not access these things. If you can't access getting a job to get money to buy food, and you can't access housing for shelter, and you need to get immunity to get these things, to get access, well, what's the next step that people would probably take? They're probably going to try and deliberately infect themselves with the disease to hopefully get it, overcome it, and develop immunity. And that's exactly what they did in that historic example. People would deliberately infect themselves with yellow fever. One of the big differences between yellow fever and coronavirus is yellow fever had a 50% mortality rate. It's lethal, and people would still infect themselves with it so that they had access to the things they need to survive. So there's an unintended consequence of creating that two-tier society. So the absolute last thing we want to do, or we want to allow or see governments doing, is creating some kind of documentation showing that you have a positive antibody test. Because we do not want people deliberately infecting themselves with coronavirus, because go back to those numbers in the first part of my video, the possible numbers of people who could die and how easy it is for the healthcare system, even in the richest country in the world, to be overwhelmed by this particular disease. So that's all of my rant for today. Is it a rant? I don't know. That's all I have to say about that for today. Finally, it looks like there may be a little bit of light at the end of the tunnel here in Panama. There was a question asked on the news, which is in Spanish, but Caesar speaks it, so he translates for me, which was a really good question. What data is the government here in Panama looking for before they start to relax quarantine restrictions? And the answer was the R factor, or the replication factor. They want it to be less than 1. It currently is just less than 1, but not in all provinces, and it hasn't been that low for long enough. So I think maybe in another 2 weeks, if everyone stays inside and abides by the rules, we may be looking at some relaxation in quarantine restrictions. So that's something to look forward to. So again, thank you so much to all the people who like to watch these little videos, and if you like it, click the thumbs up and subscribe to my channel. Thanks guys, and see you next week. Bye.